The UN Sexual and Reproductive Health Agency is appealing for over $5 million to help mitigate against the effects of drought in Zambia, especially among women and girls. The country is currently in the grips of the driest agricultural season in more than 40 years, putting the sexual and reproductive health of women and girls at risk. CGTN's Joy Kiruki-Juma with the details.
Zambia is on the front lines of a climate emergency. Acute malnutrition is high among pregnant and breastfeeding women in the drought-affected southern, western and Lusaka provinces. This is expected to worsen as the lean season begins in July.
In times of a crisis and in times of a drought like this, the health of women and girls, especially sexual and reproductive health, is not prioritized. Women may not prioritize going to the health facility in terms of a crisis of a drought like this, but instead would prioritize looking for food. So this has the possibility of impacting their health.
Risks of gender-based violence, sexual exploitation and abuse have all increased. Families are resorting to desperate measures as they struggle to put food on the table.
They don't have food. As a result, teenagers, they end up in they become vulnerable. So they engage themselves in sexual activities. So when we talk about HIV, even HIV rate, it's quite high in adolescents because they engage themselves to these fishermen because they want help, they are vulnerable.
Zambia has one of the world's highest rates of child marriage, with close to a third of Zambia's girls married off before the age of 18. As drought effects worsen, UNFPA is taking services to communities, including those hours from the nearest health facility.
UNFPA is supporting Ministry of Health to conduct the mobile clinics, the health outreach activities, so that they can provide these services to women and girls, especially in this situation.
With about 9.8 million people in 84 of Zambia's 166 districts affected and 6.6 million others in need of immediate humanitarian assistance, UNFPA is appealing for urgent support. Joy Kiruki-Juma, CGTN.